Hello my beautiful nurses, welcome back to my channel. This is RN Sakshi. So in today's video we are going to discuss about your isolation precautions, so which is very prevalent in your Nclex-RN, CPNRE or XPN exam. So without wasting any time, I will just put on some highlights that how to don on and how to doff off your PPE. So let's get started. So firstly guys, some three basic things should be clear in your mindset while preparing for your nursing exams. So first you have to make sure that what are standard precautions. So standard precautions include your hand hygiene, which is your hand sanitizer, your hand washing, and your gloves. Okay, so in your nursing exam, if it comes to a choice that you have to pick between the hand sanitizer and the hand washing, of course you have to go with hand washing, not this hand sanitizer, because there are still some chances that some microorganisms can be left with this hand sanitizer. So soap and water are the best method for your hand hygiene protocol. Okay, so for your standard one, of course, sanitizer and your hand washing and your gloves. Okay, and then coming to the contact precautions, just start adding on to the other isolation precautions. So standard is clear, then we have is your contact precautions. In contact precautions, we know that we have to be very precautious before touching anything, like if the wound is infectious, right, and we have to do the dressing for that wound. So you have to make sure that you're not touching or you're not getting in contact with that particular thing. So for that one we have, of course, so hand washing, gloves, plus we have your, what else we can have, so we have your gown, right, because sometimes your maybe your body scrubs or your anything which can be like there can be chances that your body scrubs or something can get in contact with that wound or anything, right, which is very infectious. So this was all about your contact precautions, and then moving forward we have your droplet precautions. In droplet precautions, all the infections come, like respiratory infections, except the airborne like COVID-19, right? So you have to be very precautious with those things, because for that one we have, of course, standard, which is your hand washing and your sanitizer and your gloves, and then plus your gown, which comes in your contact precautions. Now we are talking about droplet, so along with these products, now we have your mask. Okay, so and then this is simple mask, which comes in droplet precautions, right, and then your face shield. We also have the option for the face shield. Okay, and in the hospital or wherever setting you're working, they can also provide you the safety glasses or the goggles. That also comes in the category of your droplet precautions, right? So next, of course, we will be going to talk about your airborne precautions. So airborne, in that case, like COVID-19, which I just giving you an example. So in that, the droplets are very bigger, so they don't drop onto the surface very easily, right? So they just they're just left open in the air. So that's why we can inhale those. So for that one, we have N95 rebreather masks. So along with that, in that airborne precautions, if Nclex-RN asks you that what precautions you will use, so of course hand hygiene, sanitizer, and your gloves, and your gown, and your N95. Not these options, because these are like, you can wear the face shield along with this N95 if you want to cover, and your goggles as well, but not this mask, right? So these were some basic. Okay, so that was all about your donning on PPE, right? So donning on your PPE. Now we will be discussing about doffing off your PPE. Doffing off means to remove your PPE, right? So that's also very prevalent in your Nclex-RN, because these questions they love, guys, because this is the basic understanding for a nurse over here. Either she is LPN or she is RN, so they expect from us that we should be knowledgeable about these ideologies. So if we remember, we have already discussed about the donning on, right? So in doffing off, we can start with, so in donning on, remember, I just want to say this thing, that we begin from least dirtiest to the most dirtiest. Why least dirtiest? Because first we clean hands and then we wear gown, right? So gown is the least dirtiest right now because we are providing care with hands, right? So that's the most dirtiest, and in the end we are removing the gloves, right? So first we clean hands and then we wear the gown because it's least dirtiest. Then we have your face shield, mask, or N95 or goggles, right? So then they come, right? Because we are inhaling that air, right? Infectious air, right? So that comes after the gown. And then the most dirtiest is your gloves because we are providing care, because all the infectious stuff is being in contact with our gloves. So that's the fundamental for your donning on. And then beginning with doffing off. So what about the doffing off? Now in this we will be beginning with most dirtiest to the least dirtiest. So what is most dirtiest? So most dirtiest is gloves for sure. So first, after we exit from the patient's room, we will be first removing the gloves. Why? Because these are the most dirtiest, right? So even though after removing gloves, what we will do, because now we have removed the gloves, of course we will clean our hands. If we have nursing station or we have the hand washing station over there, then it's much better. But if not, then use the hand sanitizer, right? Then after that we will remove our gown, right? So we will remove the gown because this comes under the category of dirtiest one after that, because maybe after while providing the care, maybe our gown is coming in contact with the wound or something, right? So after removing gloves, clean hands, and then what we will do, we will remove our gown. After removing gown, again we have to clean hands. Why? Because we are now bare hands and we have touched our gown. That's why we will again clean our hands, right? So that's better if we have option for hand sanitizer. But if we have option for hand washing, what you will be gonna pick? Of course, hand washing, right? And then we will be removing our masks, right? Or our face shields or our goggles, right? Because then they comes after our gown, because we are providing care for the wound, right? And so we just want that we should make sure that everything what we have been in contact with the wound, or maybe we are providing the care to the droplet or airborne patients, so right? So this is the dirtiest one. So we should be make sure that this should be at the end after providing care, right? And then again, after you have provided the care, the mask is being removed, then we will again clean the hands, right? So I hope that this is the pretty much basic concept. So in doffing off, what we will be gonna doing is, first we will be removing the gloves because they are dirtiest. We cannot remove whole PPE while we are wearing those infectious gloves, right? Because we have touched the patient, we have touched the doors of that room, right? So that's why first we will be gonna removing gloves. Then of course we have to clean the hands, and then we will removing gown, right? After gown, all the face masks and your shields and your eye goggles, and then again cleaning the hands. And then after that, what the nurse be gonna doing is, we will be charting and reporting that what was the what the care has the nurse has provided to the patient. And one important thing, guys, even in my nursing practice, I have seen that some nurses, after providing care, they don't remove the gloves, and then they just they're just roaming in the hallways like that. If your resident care manager or your nurse in charge notice that, if there is a inspection coming on and they just noticed you like that and with this behavior, then they will for sure assume that nurse have not washed their hands. Nurse is not conducting hand washing practice efficiently. So these are the hallmark that either you are, obeying their hand washing protocols or not. So never walk on with the used gloves, or even the sterile gloves as well, or the clean gloves, because they think that you're not adhering to their policies and procedures, right? So these are some basic things. You can maintain some flow charts according to that what we have to, like what first we will be donning on and what we will be doffing off. You can make those, or maybe you can make acronym for doffing off, right? So what acronym can be made, right? So G, that means gloves first will be removed, then your gown, right? So GGM, right? So, and H, right, because of hand sanitizing, right? So G stands for your gloves, then gown, right, and then mask, and then H stands for your hand hygiene, so that you remember that at the end you have to do the hand washing, right? So GGMG, right? So you can make an acronym that, of course, for the G1, what you can make, right? So go Mr. Hand, right? So that can be done. So from go, that means first you have to remove gloves, then again go, that means you have to remove gown, then Mr., that means M, that means mask and your eye shields, right? And then hand means you have to clean your hands, right? So something like that, which can be easier for you to acknowledge. So I hope you like this video.